We'd more than 20,000 cases a day at the peak of the Omicron wave back in January. So how do today's figures compare with that?
Yes, Claire, so we have to remember that back in January when we had those 20,000 cases, they were 20,000 confirmed PCRs. There were many cases at that time that were done by antigen that weren't being able to be uploaded during that time. So now what we're seeing is that breakdown today, 23,000 cases in total, 23,702 I should say today, and of those PCRs 7,729 and 15,973 antigen tests. So there's no doubt that there is a massive surge of COVID-19 happening right across the country at the moment. Now, it's important to note that the concerns around this are not related to disease severity. It is about that quantity and that high number of patients potentially presenting at hospitals, because even if you come into the hospital for COVID as a secondary issue, you're still having to be treated in isolation. That has a massive knock-on effect in terms of resources within the health system. At the moment, 1,338 COVID patients in hospital. This latest surge, Colette, is due to the BA.2 strain, which is sort of a sister of the original Omicron variant. We were speaking with Professor Martin McKee, who is an expert in European public health.
We're seeing a very large number of people who have managed to avoid it being infected, even despite taking very rigorous precautions. Although part of that, of course, is that in quite a few countries, the messaging has been that the pandemic is in some way over. Clearly it's not, but that has encouraged people to lower their protective measures and made them more exposed as a result. So it's a combination of changes in behaviour and a very, very infectious virus.
Well, Colette Taoiseach, speaking today, said that the government did expect these surge in cases. Leo Varadkar saying that in Denmark they had that surge ahead of us, and he said that they noted that they had this Omicron plus sublineage first, and he said they're now seeing cases falling very substantially, and he would say that they expect that to happen here over the next couple of weeks. But the INMO, the union representing nurses, says in the interim period the government needs to act as the responsible parent and reintroduce mandatory mask wearing on a temporary basis.
Is tired of COVID-19. The healthcare workers on the front line are exhausted because they've been responding for the last 2 years to COVID-19. And we do have to reduce the level of transmission. And people talk it may be mild, but the reality is if you get COVID-19, wearing a mask will reduce the level of transmission. The level of dose that individuals will spread will be reduced. And I think the government has to behave here as the responsible parent. People may not be keen on reintroduction of measures, but the reality is it will assist. And if anything will assist, it should be considered and it should be reintroduced.
Well, separately, Colette, just a reminder from the HSE today that anyone who had COVID, particularly over the Christmas period, they're now 3 months, this week coming up to 3 months past having COVID, and they will now be eligible for their booster vaccine. The HSE estimating there's around 700,000 people who will become eligible for their booster over the coming weeks.
All right, Zara, thanks very much for that.